Hi, it's Rob Timmings here with EduVid. Delighted to be back to do another session with respiratory physiology. In today's session, we're going to be having a look at a big one. This is a big ticket item for most nurses who work in respiratory or critical care, and it's blood gas analysis. I hope you had an opportunity to have a look at our gas exchange session that's been put together, where we looked at the cascade of oxygen down through the external respiratory pathway, oxygen from atmosphere to blood. This builds on that because now what we're actually going to do is have a look at the pressures of gases, carbon dioxide and oxygen, in arterial blood. Now, I know that you're familiar with both arterial blood gases and venous blood gases. Venous blood gases have no role, the taking of venous blood gases have no role in respiratory medicine or critical care medicine. The purpose of venous blood gases is really to look at the pH of blood and determine whether a patient's in a state of acidosis or a state of alkalosis, whether their blood is too basic or too acidic. Arterial blood gases, they do exactly the same, but they really come into their own when we want to have a look at things like diagnosing respiratory failure. So you may recall from a previous video that respiratory failure is based on the level of oxygen in your arterial blood being less than 60 millimeters of mercury. So let's have a look at some normal values. In this particular session, I want to unpack a strategy that I use when I'm doing blood gases. Whenever I look at blood gases, I always pull off a piece of paper towel from near where I'm going to analyse those blood gases, and I use a hashtag, or I use a tic-tac-toe or a noughts and crosses technique. So if you're not familiar with that technique, it's an age-old technique. I'm sure that many of you will be familiar with it, but if you're not familiar with that technique, then perhaps this might be the first time that blood gases make sense for you. I'd love to hear some feedback if that was the case. So let's look at your normal values. First of all, the premise here is we're looking at a sample of blood taken from arterial blood. So let's just look at where that's come from. It's come from the lungs to the left heart. It's been pumped out of the aorta, and now it's been distributed around the body, where we may have collected it from the radial artery or from the femoral or from even a brachial artery. The point is that this is blood that has become oxygenated by the lungs, and it yet hasn't gone anywhere to get rid of its oxygen. So we're getting the freshest, cleanest, most oxygenated blood in the body. And that's the whole reason that we're interested in looking at respiratory values using arterial blood gases. Because if I looked at venous blood gases, that blood's been all around the body, distributed its oxygen, and of course it's oxygen depleted when it comes back to the lungs. So was the venous oxygen low because the body used up the oxygen, or was the venous oxygen level low because the lungs never put it into the blood in the first place? We can't know the answer to that question. So to really drill down on respiratory function, we need arterial blood gases for that reason. So these values that you see here on screen are arterial blood gas values. First of all, the pH. This is a measurement of the acid-base balance of our blood. Blood is normally ever so slightly alkaline. If we took a sample of the fluid that we call blood to a chemist, and we said, tell us whether we're looking at a neutral substance here, whether we're looking at an acid or whether we're looking at an alkali, the reality is that the chemist would have to say, well, with a pH averaging 7.4, it's ever so slightly above the neutral pH of 7.0, which is distilled water. And for that reason, blood is therefore slightly alkaline. So when we talk about acidosis, or acidemic blood, or acidic blood, we're not necessarily only referring to blood that's below 7. We actually are referring to blood that's below its normal range. And so the normal range for arterial blood is, for pH, is 7.35 up to 7.45, with a mid value of 7.4. And your physiology works very hard. Your lungs and your brain and your kidneys work very hard to try and maintain that pH at neutral 7.4, irrespective of what you're doing. And so if your pH should start to fall slightly into acidotic territory, then you will retain more base in your blood to buffer the effects of that. Likewise, if your blood becomes more alkaline, more basic, then you will retain more acid to buffer the effects of that. And that process is what we refer to in blood gas analysis as compensation. So let's have a look at the normal value then. Normal pH for arterial blood, 7.35 to 7.45. Should my patient's arterial blood sample demonstrate a value less than 7.35, so lower than 7.35, it's referred to as acidosis. Should the patient have a blood gas sample that shows a pH above 7.45, then we refer to that as alkalosis. And there's two main influencing factors on the acidity and the alkalinity of your blood. The two dominant factors that we measure through blood gas analysis is bicarbonate, HCO3, bicarb, which is your natural dominant alkaline salt in your blood, and that's regulated through your kidneys. So your renal system regulates that bicarbonate level. Between your blood and your kidneys, those bicarbonate levels fluctuate ever so slightly to add a little bit more alkali or to remove a little bit more alkali from the blood to maintain a neutral pH, close to 7.4. And the dominant acid that's in your blood is actually formed from the combination of water in the blood with carbon dioxide. So if I mix water and carbon dioxide in a soda stream, I get soda water. The chemists don't call it soda water, they call it carbonic acid. And the same process happens in your blood. If carbon dioxide in your blood should rise, carbon dioxide excess combines with water molecules in your blood to form a weak acid called carbonic acid, HCO3, H2CO3. And so as that carbonic acid, carbon dioxide levels rise in your blood becomes more acidic. So with carbon dioxide is the dominant acid in your blood. And you're probably thinking, well, carbon dioxide's not an acid, it's a gas. Yes, it is. But if I was to mix carbon dioxide with water, it becomes an acid. So if you blend carbon dioxide or force carbon dioxide into water in a soda stream maker, as an example, we turn it into soda water, the chemists would call that carbonic acid, H2CO3. And it's the same principle in their blood. As carbon dioxide levels accumulate in your blood, and remember, we get rid of carbon dioxide by breathing out. So the faster we breathe and the deeper we breathe, the more we expel carbon dioxide, regulating carbon dioxide levels. And it's those regulated carbon dioxide levels that directly relate to how much carbonic acid is formed in the blood. And that's that carbonic acid that is the weak acid that buffers the effect of pH, again, maintaining a normal pH. So it should stand to reason that if your bicarbonate levels went through the roof, your blood would become alkaline. If your CO2 levels went through the roof, and you can think of some medical diseases where patients' carbon dioxide levels become grossly elevated. The CO2 retention that we see in a COPD patient or a patient with a severe chest infection is a great example of that. As CO2 levels rise, blood becomes acidic. And that means the kidneys now need to work harder to buffer the effects of that acidity because the lungs have failed to get rid of the acid, so the kidneys now need to work harder to accumulate alkali to balance that mix. Yeah. So let's have a look at these normal values. We've already talked about oxygen in a previous episode and at the beginning of this, where we said a PaO2 in arterial blood normally is 80 to 100 millimeters of mercury. So we can simply look at the PaO2 on a blood gas sample and say, is the patient well oxygenated or are they poorly oxygenated? If they're poorly oxygenated, below 80, we call that hypoxemia, and if it drops down below 60, we'll call that respiratory failure, particularly type 1. Carbon dioxide levels in arterial blood normally hover between 35 and 45 millimetres of mercury. Again, it's a gas pressure. So it's reflected as a partial pressure or a pressure of arterial carbon dioxide, PaCO2. 35 to 45. To be friends, we could say 40 is normal. And that bicarbonate salt that's regulated dominantly through the kidneys, bicarbonate, HCO3, it normally sits between 22 and 26. It's not a gas, so it's measured in milli-equivalents or in millimoles per litre. So 22 to 26 milli-equivalents. So again, we could say that that's completely normalised at 24, smack in the middle. So if you've got a blood gas sample that comes back with a pH of 7.4, with an oxygen of 90, with a CO2 of 40 and a bicarbonate of 24, you couldn't get more normal, you couldn't get more in the middle. That's absolutely smack in the middle.
My Health PD, more than just CPD.